In today's health headlines, is being angry bad for your heart? The recommended age to begin mammograms is now 40, and birth rates are at a historic low in this country. Joining us now is Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine, Dr. Arjun Venkatesh. Thank you for being here, Doctor. We appreciate it.
Hi, thanks for having me.
All right, let's start with this new study now that found a surge of anger can increase your risk of a heart attack. What do we know about that?
You know, we've known for years that increased stress and anger can be associated with heart attacks. What this study did was really interesting, though. It actually showed in an experiment that it might be linked. What they did is they took 280 healthy volunteers, and they exposed some of them to anger, some of them to a sad thought, some of them to anxiety, and some of them they just asked to count to 100. And here's what they found. They found that the people who focused on anger and were angry for about 7 or 8 minutes, they could actually see changes in their blood vessels that we see in people when they have more heart disease and eventually heart attacks. They didn't see it in the people that were exposed to anxiety or to the sad episode. And so I think it sort of sits with what a lot of us have thought, which is if we can help kind of control our anger, find ways to calm down, find ways to cope with different stresses in life, it might even turn into some heart health down the line.
Another reason to let it go. All right, good. Experts now recommending that women begin regular mammogram screenings starting at age 40. Why that change, and what do we know about that?
This is really big news, and it's a recommendation that came out in draft form last year from the U.S. Preventive Care Task Force and then was just finalized this week. And what that recommendation says is that since probably almost over 10 years from now, we've been recommending that mammograms start at age 50. But because of an uptick in breast cancers that we see in women in the age 40 to 50 age group probably since 2015, the recommendations are now changing to recommend mammograms starting at age 40 and at least every other year. There's certainly some people that think this doesn't go far enough and that it should be every year. There's some others that think it shouldn't just be coverage for standard mammograms, but also ultrasounds or MRIs for women with more dense breast tissue. So talk to your doctor, but most importantly, make sure that you're getting the recommended screenings.
All right, birth rates in this country have reached a historic low now, falling 2% since 2023. Why is this significant?
You know, the CDC puts out the number every year about birth rates. The number has actually been going down since 1971, I believe. What's significant about it this time is that this has really gone down more suddenly and more rapidly in recent years than it has ever before, and that we've hit an all-time low in teen pregnancies. And I think that's the bright news here, that a lot of efforts probably around creating economic opportunity, reproductive health opportunities, and things like that for young women, access to birth control have really helped there. On the other hand, what we do see is increases in C-section rates, birth rates that are happening later in life, more complications in birth. And so there's a lot to be done to improve maternal health in this country. But it is a new, I think, in some ways, a positive sign when it comes to teen pregnancy rate.
Dr. Arjun Venkatesh from Yale, we appreciate your time. Have a great day.
Thank you.